All right. Thanks so much for coming out tonight. I'm glad that you remembered that we were having this presentation over memory. I am Tiffany Roberts, for those that don't know me. My husband and I own a functional medicine, holistic, and natural medicine clinic in Prairie Village, Kansas, where we thrive to educate the community about all kinds of different natural remedies for your health and your happiness. And I'm so glad that you came out tonight to listen to the presentation. And if you have any questions, please put them in the chat, and I will try to address those as quickly as I can. All right. So, do you ever stop to think about your memory? Many of us focus on our physical and emotional well-being, but memory deserves just as much attention, because without it, our memory can start to slip, and with enough deterioration, Alzheimer's disease and dementia can begin to develop. The good news is that with attention and lifestyle changes, there are things that you can do to start protecting your memory, and we will be taking a close look at just how. But first, let's examine how memory works. The Peak Performance Center states that memory is the mental function that enables you to acquire, retain, and recall sensations, impressions, informations, and thoughts that you have experienced. The amount of time memory is available to us is broken down into 3 stages. You have sensory memory, short-term memory, and long-term memory. And it sounds pretty straightforward, but let's take a closer look at each stage. Sensory information refers to the information received through the senses. It is the first stage of memory, and it often lasts no more than a second or two. So the bird you can watch across the sky and then land on top of the tree, while it is an action that you are sensing and perceiving, it may not be the information your brain decides to store into short-term or long-term memory. The primary types of sensory memory are iconic memory, and this is visual stimulation, which forms a picture in your mind. For example, when you look at something and then close your eyes, and for a brief moment, you can still see that image present before your eyes were closed. The next one is echoic memory. This is auditory sound waves sensed by the hair cells in your ears that then travel to the temporal lobe of the brain. An example of this would be hearing someone speak and then hearing the sound of their voice and the details of the language, but, fleetingly. The next one is haptic memory. Sensations the body feels, such as pain and movement and stimulation. An example of this would be the sensation of petting a dog. So now let's look at how short-term memory plays a role. Information in short-term memory is not stored permanently. Information passes from sensory memory into short-term memory, where, it is held for only a short period of time. Most of the information stored in short-term memory will only be kept for approximately 20 to 45 seconds. Short-term memory is also known as active or working memory, because while memories in the stage only stick around for a matter of seconds, it is here that the mind processes and encodes useful information to allow it to pass along into long-term memory. This stage sounds similar to sensory memory, but with sensory memory, the mind receives a complete image, whereas with short-term memory, it receives an individual's interpretation of that image. And now, on to long-term memory, the mind's memory bank. So long-term memory refers to a lasting retention of information. Psychologist Endel Tulving explained the levels of long-term memory by breaking it down into three categories: procedural, semantic, and episodic. So procedural memory is a part of long-term memory responsible for the unconscious ability to do things, such as riding a bike. That's put into your long-term memory. We remember how to do that procedure. Semantic memory is a part of long-term memory responsible for consciously storing information learned, such as a word, meanings, histories, and general information. So an example would be knowing the state of capitals, the capitals of each state. That would be a semantic memory. Episodic memory is a part of the long-term memory responsible for consciously storing information about events experienced at any stage in our life. Remembering a childhood trip to the beach is a good example of this. So considering these three categories, in what stage do you think most of the breakdown occurs with memory loss? Well, the American Psychological Association studies have revealed a pattern of memory loss most often occurring in the episodic memory, which relates to trouble recalling dates and times of events. So I'm so glad that you remembered this episode of tonight's presentation. The problem they have found is not the ability to store old and new information in long-term memory, but rather a problem with assessing and retrieving the stored information. There can sometimes be an interference that prohibits access and retrieval. But why does this happen? Well, it is usually around age 40 when people start to take note of subtle changes in their ability to multitask or to remember new information. And this is a sign that key areas of the brain responsible for memory start to shrink or atrophy. At this point, there is typically a significant reduction in connections among neurons. As the brain changes, so does behavior. And so given that blood flow drops the most in the frontal cortex, most people most commonly experience declines in verbal fluency or the ability to find words they want. They also have to work harder at executive function, planning and organizing their activities. So maybe you are wondering if this is simply the effect of aging and if there is anything that can be done to protect your memory as you age. The National Institute of Aging states that while there are many things about the aging process affecting memory that are simply the result of an aging body and mind, there are still many factors within our control that contribute to memory retention, including adequate sleep, reduced stress, regular exercise, a healthy diet, and creating new experiences. Let's take a closer look at how these contributing factors, when out of balance, can have a negative effect on our memory. Elizabeth DeVore, an instructor of medicine at Harvard-affiliated Brigham and Women's Hospital, reported in a sleep study that her team's findings suggest that getting an average amount of sleep, about 7 hours per day, may help maintain a memory in later life, and that clinical interventions based on sleep therapy should be examined for the prevention of mental impairment. Dr. Howard Lewin, chief medical editor of Harvard Health Publishing, attributes a lack of sleep to high blood pressure, diabetes, and narrowed blood vessels, all of which can contribute to a weakened blood flow to the brain. Additionally, lack of sleep deprives the brain the optimal time it needs to catalog and store those memories, as well as regenerate, allowing the mind to process new experiences and access memory. So how do we get more sleep? The Better Sleep Council suggests that you can make 8 hours of quality sleep a regular part of your life by scheduling it in. Make sleep part of your to-do list and plan your bedtime like you would any other appointment. You wouldn't miss a meeting with binge watching TV, would you? Be strict about your sleep appointment in the same way. Keep a consistent schedule for sleep and wake times soon they will become just as part of your regular routine. Support your schedule by creating a bedtime routine that relaxes you with maybe hot baths, a good book, or soothing music. So here's how. Do not eat or have alcohol at least 3 hours before sleep. No caffeine after 2 p.m. Limit exercise to at least 2 hours before bed. And do not use the computer, phone, or tablet in bed. And try some stress-relieving exercise before bed, and we'll get to that. So when you can't sleep, what do you think is your primary cause? Is it stress? So how does stress affect memory? Stress elicits a response from the body by telling the brain that you are in danger, and the body responds by releasing a hormone called adrenaline into the bloodstream. Adrenaline works to increase heart rate and blood pressure to support the fight or flight impulse. This is great if you're in danger, but a constant state of arousal can lead to long-term anxiety and fear, which are stressors known to have a negative effect on our memory. Additionally, stress can activate the pituitary gland to release hormone called ACTH, which then activates another part of the adrenal gland, telling it to dump cortisol into the bloodstream. While cortisol can have some beneficial effects when it comes to relieving stress, it binds to cells in the brain's hippocampus, the area responsible for converting new experiences into memory, thus disrupting the memory forming process. So, do you make stress management a priority? With over 75% of doctors' visits being due to conditions caused by stress, it's easy to see why learning some stress-reducing techniques is good for your overall health. Not to mention as a preventative measure when it comes to reducing your risk in developing dementia. Before I go into that, let's talk about reducing stress. And these are simple ways that you can do at home, okay? And each person's going to be different. You have to find what makes you happy to help you reduce your stress. But here are a couple of examples. Exercise. Exercise is a great stress reliever as it works as a natural remedy for anxiety by releasing endorphins. This is the body's built-in mood enhancer, and that is released in the brain. Exercise also helps improve sleep. Meditation. Meditation is proven a stress reliever that eases anxiety, and when practiced regularly, results in a feeling of overall improved well-being. Acupuncture. Acupuncture has been used effectively for treating many stress-related conditions such as anxiety, high blood pressure, and depression. So next up, a guided meditation. Finding stress relief for some of us is a continuous journey. Meditation is a great stress-relieving practice, and it can essentially be done any time of the day. All you need is just a few minutes in a quiet place. If you are new to the concept of the practice, try this guided meditation to get you started. Your mind and body will thank you. So to perform this meditation, find a comfortable position. either seated in a chair or on a floor with the use of a cushion if you need. Keep your back straight, but don't go rigid. And rest your hands on your lap. Simply close your eyes and take a moment and notice the shape of your body, its weight, and how it feels. Then slowly become aware of the sensations around you and within you. Relax any of the body's feeling tight by breathing into that tightness. Tune into your breath and allow it to come in and out naturally, and notice where you feel it in your body. You might notice that your mind may start to wander, and this is natural. Acknowledge it and bring it back to focus, to the focus of your breath. Try to stay in the experience for 5 to 7 minutes. From time to time, you'll get lost in thought, and when you do, just return back to your breath. So have you ever tried meditation? And if so, what was your experience? And it's just as simple as that. Just taking just a few moments just to quiet yourself and to just feel the moment and be present. That's just as simple as that. So according to Harvard Health Publishing, exercise helps memory and thinking through both direct and indirect means. The benefits of exercise come directly from its ability to reduce insulin resistance, reduce inflammation, and stimulate the release of growth factors. These are chemicals in the brain that affect the health of the brain cells, the growth of new blood vessels in the brain, and even the abundance and survival of new brain cells. Indirectly, exercise improves mood and sleep and reduces stress and anxiety. Problems in these areas frequently cause or contribute to cognitive impairment. Additionally, many studies have shown that the prefrontal cortex and the medial temporal cortex, the parts of the brain responsible for thinking and memory, have greater volume in people who exercise versus those who do not. The exercise thought to be the most beneficial is aerobic exercise. So let's take a look at some examples. When you talk about aerobic exercise, we are referring to exercise that kind of gets your heart pumping, such as a brisk walk, running, or cycling. Our favorite exercise is just taking a family walk in the evenings. Another way to boost your memory is through a healthy diet. Just like exercise, stress relief and improved sleep can help protect and rebuild your memory, and diet plays an important role too. A UCLA study published by the American Journal of Geriatric Psychiatry, tongue-tied, found that the Mediterranean diet is the one main lifestyle factors that seem to keep the brain from developing the toxic plaques and tangles associated with the development of Alzheimer's disease. Plaque refers to deposits of toxic protein called beta amyloid in the brain, which has been linked to the development of Alzheimer's disease. Also, Ganoderma mushroom can also reduce the plaque in the brain. So for my patients that are watching, drinking your organo coffee is definitely helping remove the plaque in your brain. So food staples of the Mediterranean diet include fresh fruits and leafy green vegetables, olive oil, nuts and seeds, legumes and beans, herbs and spices, whole grains, wild-caught fish, and pasture-raised poultry, cheese, and eggs. Not cage-free, you want free range. where you are aware that nearly every minute that goes by, someone develops Alzheimer's disease in the US. And to me, that's quite frightening. This is shocking statistic, but as we've seen, there are some things that we can do to protect our memory, and while eating a healthy diet is key, that is also means that on the flip side, there are some foods that we need to avoid to reduce the risk of developing Alzheimer's disease. So, red meat. The iron in red meat is a great addition to the diet, okay? But you want to make sure that it's grass-fed. Too much red meat can mean a buildup of iron in the gray matter of the brain, which is the area of the brain that is typically shows the first signs of degeneration as we age. We typically say, in our family, we eat red meat maybe 3 times a week. The rest of the time it's fish or strictly vegetables and fruit. So stay away from refined carbohydrates and sugars. Carbs and sugars raise glucose and insulin levels, which causes a spike in blood sugar. Over time, this can lead to insulin resistance and damage the blood cells in the brain responsible for memory. Again, the organo coffee, guys, helps reduce the glucose and the insulin levels. So this is going to help balance out your sugar as well. So while your memory is not a muscle, it can atrophy when it is not receiving adequate exercise, okay? So how do you exercise your memory? By engaging your brain in activities that increase your mental effort. In this day and age, we have become more reliant on our computers and mobile devices to store our personal information, our phone numbers, or even important dates, and less reliant on our memories to recall that information. In an effort to increase your memory and to reduce the risk of developing Alzheimer's disease and dementia, it is important to play an active role in how you exercise your memory. Let's look at some great memory boosting exercises to try. Every day, Health Online lists creative ways to help boost your memory. So test your recall. Make a list of grocery items, things to do, and anything else that comes to mind, and memorize it. An hour later, see how many of those items that you can recall. You can also learn to play a musical instrument or join a choir. Studies show that learning something new and complex over a long period of time is ideal for the aging mind. Do math in your head. Figure out problems without the aid of a pencil, paper, or computer. Take a cooking class. Cooking uses a number of senses such as smell, touch, sight, and taste, which all involve different parts of the brain. Learn a foreign language. The listening and hearing involved stimulates the brain. What's more is a rich vocabulary has been linked to reduce risk of cognitive decline. Create word pictures. Visualize the spelling of a word in your head, then try to think of any other word that begins or ends with the same 2 letters. Draw a map for memory. After returning home from visiting a new place, try to draw a map of the area and repeat this exercise each time that you visit a new location. Challenge your taste buds. While eating, try to identify individual ingredients in your meal, including subtle herbs and spices. That's my favorite part. I love doing that. Refine your hand-eye abilities. Take up a new hobby that involves fine motor skills such as knitting, drawing, painting, assembling a puzzle, or even adult coloring. I love doing that. That also reduces stress. Learn a new sport. Start doing an athletic exercise that utilizes both mind and body, such as yoga, golf, and tennis. Thank you so much for attending this event. It was quick, and I hope that this experience has left you feeling more knowledgeable when it comes to protecting your memory and ready to start taking some proactive steps for your health of your mind. If you have any questions, please let me know. You guys know where to reach me. You can always email me, Facebook message us, you can text us, or if you have any questions right now, I'd be happy to answer those for you.